Over the years, we've seen stethoscopes go from one patient's body to another patient's all day long without ever being sanitized or disinfected. Every year, 1.7 million patients suffer from hospital infections, and 100,000 die as a direct result. Now, the consequences of hospital-acquired infections not only cause health-related complications and increased mortality rates, but also create significant financial costs that burden the patients and the healthcare delivery systems. What would be the reason for the neglect of this important preventable hygienic issue? Practicality? Every single time a stethoscope is being used, it has to be cleaned by alcohol. In practice, it rarely happens. Why? For 3 reasons. 1, it's time-consuming. 2, it can be ineffective. 3, repeating this process too many times damages the sensitive stethoscope diaphragm. Recently, Medicare implemented a new policy that denies payment to hospitals for certain type of inpatient-acquired infections, including staph infections. Despite advancement in technology, hospital hygiene remains the #1 priority in the healthcare system. This includes all settings of medical care: hospitals, clinics, nursing homes, and private practice offices. The stethoscope is the most widely used medical instrument in the world. It's used by physicians many times a day. Each person in our country is exposed to a stethoscope numerous times throughout their life. However, very little attention is paid to this apparatus, and it can become a vector for harboring infection. Several studies have shown that the stethoscope heads can harbor pathogenic bacteria. In one study, 87% of stethoscope heads were contaminated. Currently, stethoscopes cleaning with alcohol is the only available option for infection prevention. However, cleaning with alcohol can be ineffective. One study conducted in an ICU showed that the contamination was reduced from 71% to 30% after cleaning the stethoscope with alcohol. That's why using a barrier method becomes so important. A stethoscope diaphragm cover has been developed by the joint efforts of a doctor and an engineer. This cover would fit over the entire stethoscope head. It's simple and easy to insert and extremely cost-effective and inexpensive. It is made of a polyethylene film. Not only does it cover the flat part of the diaphragm, but it also covers the edges of the instrument. This creates a completely hygienic barrier. The dispenser is manually operated. The shuttle pushes forward 1 rim at a time. A user can easily cover the stethoscope head by pushing it through the dispenser, transferring the cover from the rim to the stethoscope. These covers come in packs of 20. There are single packs also available for those who might need to use them at a remote location or out of a medical establishment's on-site care. This simple and effective stethoscope head cover will provide millions of dollars in savings for the healthcare system and will provide safety for all of those who come in contact with a stethoscope.